Ms. Janet Jones, you are Breastfeeding Success, and you're here on behalf of Breastfeeding Success and yourself, and you're a business owner, and you're for the bill.
That is correct.
Thank you.
Thank you so much, Chair Hull, for introducing this bill. Thank you, Vice Chair, and for the rest of the committee as well for allowing us to speak on this. It's actually so refreshing to actually hear from our legislators informed, or really information about how important this service is for families, how it can save money and save lives. So I am Janet Jones. I'm the owner of Breastfeeding Success. I am on the board of the International Board of Lactation Consultants, of ILCA, International Lactation Consultant Association. And I have around 90 employees. I am all the way across Texas, and today I'd like to really talk with you about the business aspect of this and how it can really help businesses across Texas, as well as those families. So we've heard all about the health benefits for moms, but it's quite difficult to become an IBCLC. It takes a college level experience with the health science courses, 95 lactation specific hours of education, and then anywhere from 300 to 1,000 direct clinical contact hours working with families before you sit for the board exam. It takes anywhere from 6 months to a year for most people, even on an accelerated course. Within my company, we actually take on that expense and we provide a paid internship for aspiring IBCLCs from all across the community that look like those communities that they're serving, and really opening those doors and removing barriers to entry into the field. Currently, we are in network. We have a multi-specialty group of RN IBCLCs, standalone IBCLCs, registered dietitians, nurse practitioners, and a physician oversight as a pediatrician who's also an IBCLC. Last year alone, we provided care to over 31,000 families. And as everybody up here has mentioned, close to half of those people are on Medicaid. But because we have a heart for what we do and because we believe in our core values that every family deserves access to care and informed consent on how they're going to feed their babies, we provide that care as free charity care. And an estimated cost for us that we took on as a company was around $2.1 million for all of those services that we provide as free charity care. We're already providing those services, and this bill would allow us to be more competitive. Currently, I am losing qualified providers to firms out of state, particularly in Chicago, that really specialize in providing this care to affluent people with PPO plans. So this would allow me as a business owner to be competitive, retain that talent, and grow this resource across the state of Texas. I have hospitals all the way from Panhandle down to the Valley, from El Paso all the way to Beaumont, who want this care, who struggle to be able to afford to employ lactation consultants in the hospital or have them in the resource. So I am in support of this bill, and I really hope that we can get it through.